she had a question about these codes, the 655 and 656, are fetal conditions codes affecting the mother's care. Okay, and her basic question here is, when do you separate the charts? When do you have a baby chart and a mother chart? So, and it gets very confusing because of the wording and the terminology of the conditions, because it'll have the mother mentioned in the baby and the fetus, and all this stuff is listed in the description of the code. But this is what you need to know. And look, didn't I find a precious picture?
Yes.
The best way to remember this is before the baby is born, it is one, you're technically one person. So the mother and the baby's chart is never separated until the baby comes out. Once the baby comes out, then it's two charts. So once delivery has happened, and what is that, like the fourth stage of labor, or the fourth stage is actual delivery. So after that stage, you have two charts. So the wording can get very complicated. Whenever the mother comes in, even if it's the day she's delivering, then the mother, whatever complications even the fetus is having, and that can be fetal stress. The mother can have hypertension, but the baby can be under fetal stress. That's all going to go in the mother's chart because the baby has not delivered. So any complications of the fetus before the baby's born goes into the mother's chart, and it will usually say complication, and then it will tell you what type of a complication it is, and there can be all kinds of them. So if we scroll down just a little bit, things that you'll see once the baby is delivered, that last stage of labor has happened, you've got a baby's chart, and then you're going to see complications like aspiration. It's the meconium. Someone's going to correct me on that, but if a baby in utero has had a bowel movement, then they have that green stuff, and they can aspirate that, and they can get an infection. It's very treatable, but that's one thing that they always ask mothers about. Low birth weight. Now they can check the the size of the baby before it's born, and they will comment on that, and they will code that, and it will go on the mother's chart. But once that baby's born, and it's called light for days, is how it's looked up. It's on the baby's chart. So just always think in your head, not necessarily what the words are telling you, but has the baby been delivered? Two charts. That's what you need to know. And it's Rosalina posted on there, MAS, meconium aspiration syndrome. And it's green. And they know right away, because as soon as your water breaks, it's green water instead of clear. So anyway, that before the baby was born, then it's a complication on the mother's chart. As soon as that baby comes out, it's the same thing. It's a complication to the baby. Okay, and then it's separated. Two separate codes, two separate charts. Okay, real quick, hopefully for you. You can go into real depth of this, and maybe later if somebody has more questions, we can do that at another time.
Great. And Leslie was saying in Pearland, they call it mama bills and baby bills.
There you go. That's right. Once you figure out the separation and you get it in your head and it clicks, it's not complicated. But that's why OBGYN coders get paid the big bucks, because it's multiple codes for stuff like this.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.